and thank you for joining us today for the Home Instead Aging Well series. And today we are going to be talking about all things related to men's health. So we all know that as you age, we expect maybe some wrinkles and a little gray hair, but what else? And what are some things that you can do to make that transition into the golden years be the best years yet? So today we have some subject matter experts who are going to teach us a thing or two about that subject. From Kindred at Home, we have Nicholas Harpster.
Nice to have you here.
Thank you for joining us today. And from Home Instead, we have Shan Wilkins.
Hi.
Thank you so much. Well, I wanted to start with a study that I found from the Longevity Project that said working a job you love, having good friends, good relationship, or a good marriage are the key to sticking around a long time. So what are your thoughts on that?
Makes sense.
It does.
It does. It just makes sense. I mean, if you're happy, you're going to be more productive. You're going to be healthier. So yeah, that totally makes sense to me.
Have a better outlook.
Mm-hmm.
Absolutely.
Well, so there's this whole spectrum of aging adults, this whole spectrum of baby boomers. Sometimes they include people age 55 and over, age 65 and over. You have people who might have children at home, people who might be taking care of aging parents, and then people who are entering into this age as well. So it seems like there's this wide spectrum that it covers. You can be in a variety of places. But I think there are some issues that cover the entire group. So for example, prostate health, it seems to take a lot of men by surprise.
I know, and I don't know why. We hear about it quite a bit. They have the test kit commercials on, but men just do not, they don't think they need to. It's the next guy that's going to have the prostate problem. It's not going to be me. So I don't know why, though. It's like our mammogram. We have to go get mammograms. You gentlemen have to get your prostate tested.
Yeah, I think it goes back to your initial question about having that companion to, really hold each other accountable to do these normal yearly checkups and really just focus on your health. I think us as guys also, we don't like to have those types of discussions, maybe when it pertains to our bodies, but at the end of the day, we're doing ourselves a disservice if we aren't being proactive and, learning about our bodies and how we maybe can mitigate some of our health issues down the way. So just kind of takes a special person to remind you to get in there and get that checked.
So it sounds like maybe having some conversations that may initially feel not comfortable, but doing something that's not comfortable doesand kill you.
Right, and it's just part of life.
Right.
Like he said, you want to mitigate the problem before it becomes a problem. And historically, we know that if men don't get their prostate checked on a regular basis, it can become a problem. So it's better just to pull up your boots and go get it done. Just get it done.
Well, it's really interesting because I pulled some statistics here from the National Cancer Institute that prostate cancer is actually one of the most common cancers, and that 90% of men over age 60 have an enlarged prostate.
But that doesn't necessarily mean they have cancer. So, that's why you do want to go get it checked, because it could be other things. It doesn't have to be cancer, but if you're taking care of your prostate sooner than later, you may mitigate bladder infections and those types of things going on. I mean, so don't think the worst, but it is the most common in men for cancer, prostate cancer over that age, yeah.
Right, so don't think the worst because it could be a variety of things. Like the prostate does enlarge over time, so it could be inflamed, it could be enlarged, not necessarily cancer.
Right. And there's medications for all those things, so you don't have to be uncomfortable. So if you can just talk to your family doctor, we're doing telehealth visits now, so you can sometimes just have a conversation with your physician and they can try different regimens with you before you even have to go in for a test. So
there are a few prostate myths I thought we could discuss. One of them is an enlarged prostate is just a natural part of aging and you can't do anything about it.
I don't think that's true.
I think that's an interesting take. I would go back to just, again, listening to our bodies, and you're right, it may not be the worst, it may not be cancerous, or it may not be, I don't know, anything of concern, but we get insurance and we do these things for a reason, and I think that if we're not going to utilize our benefits at hand, and get yourself back under control. Nobody likes to be uncomfortable, so
Right.
I'm sure it's impacting more than just their health and well-being. I'm sure it's impacting social life, their families, their day-to-day. So I think sometimes as guys we don't think about all of the impacts that it's having, not just solely health. It could be a multitude of things that it's impacting.
And the fear, it seems like sometimes there's this fear. It's this fear of not knowing, but really there's power in knowing. You don't have to wonder anymore if you know exactly what's going on.
Mm-hmm.
Correct.
Yep.
Another myth is this only affects men in their 70s and 80s.
No, I don't think so. It could be a little bit of genetics. I do not think that's the case. I think lifestyle, if you have diabetes or if you've had cancer in the past or your family has a history of this type of cancer. So I wouldn't say that. I think it could be a lot of things.
If I ignore the problem, it'll get better all by itself.
Oh, absolutely.
That's more than just prostates. I think that's all health. It'll just go away.
Yeah, I can will this away. Just let me think about this.
Yeah.
Another one is, it's not really all that serious, so why should I bother anybody about it?
Well, first of all, you've paid for your benefit. So, and second of all, that's what physicians went to college for, is to heal people and take care of people. So you're really not bothering anybody by going and having a checkup. Doesn't bother anybody.
So much easier being proactive, empowering yourself by getting the information than being reactive later.
Well, and it's funny how they don't want to bother people, or they don't want to take time off of work or this or that. And I tell people, if you're proactive instead of reactive, you're not going to be taking time off of work, or you're not going to be missing the school play or this kind of activity. But if you don't take care of it, you're going to be missing those things for long periods of time versus just be proactive and don't be reactive. So.
And it'd be interesting to talk to families too, just that have gone through different experiences through healthcare, because I think that the way the system is set up, and those that have had experiences with loved ones, maybe as they're ending near of life, or maybe starting their initial journey through assisted living. Again, it goes back to not being proactive. We're not allowing ourselves enough time to really have a solid plan in place, not only for ourselves, but for our loved ones. And I think that there's so many different hoops and hurdles that we as consumers have to jump through in this healthcare system. So if we can educate ourselves early on and understand kind of what steps to take, or who to call, or I call my primary for this or my specialist for that, it'll just make your life and your family's life a lot easier down the road. It'll be, instead of using that time to really understand the system, you can spend that with your loved ones instead. So I just think it all ties back into being proactive.
And I do think people forget the benefits, like Nick was saying. If you're proactive, you won't drag your family into stuff. They won't have to take time off work to take you to an appointment down the road. I think people forget, they think they're bothering their loved one or they're bothering their spouse to go with them to one appointment. And if you look at the bigger picture, if you don't be proactive, like I said earlier, then all of a sudden you got your kids meeting you up in the ER because something's happened, or there's a surgery and somebody's taking out 3 or 4 days from work. So you're not only you're inconvenienced, but now so are all your loved ones. Not to mention just the spiritual, mental, and physical drag it does to family members when a close loved one is ill.
Well, that's a good point. I mean, nobody loves to see their loved ones hurting either. So, I think that, and it's not just guys, I think women are also stubborn at times, but we become pretty stubborn. And, I think it's just one of those things where you really need to do some self-reflection and figure out, hey, this is more than just me. This is impacting a broader scale, my loved ones. So get in there and get it taken care of. I mean, it's
what,
why not? You know,
half a day,
exactly, right?
go to
yeah.
lunch afterwards.
Exactly.
Right.
Yeah.
Well, and you mentioned some of the impact that it has on family members, and it can also have a financial impact. As you mentioned, if you have to miss work, or even if you're from out of town and you have to travel to help someone with these issues.
Right, and yeah, so if we can just think about it in the big picture, it's literally, what, a half a day, you know, make the appointment in the morning, go in the morning, and then you're done.
Right.
And you're empowered, you're gonna know and be able to plan versus, oh no, reacting and not being able to plan, so.
Now, Nick, you mentioned planning.
Yeah.
And what are some of those things that you think men should plan for that maybe don't typically come to mind?
Yeah, I would say, you know, not necessarily as it pertains to just prostates. I would say it's key to really come together with your loved ones or your support team and figure out what your plans are. What do you want for your journey in this life? You know, one thing that sticks out just in terms of long-term planning would be advanced directives. So a lot of folks don't understand that if things happen or an unfortunate situation happens and maybe we become incapacitated or we're not able to ambulate or something like that, if we don't have those directives in place, you're really at the mercy of others steering your care. So again, going back to proactiveness, why not take the time, take a day, you know, take some time to reflect and figure out, what do you want? What do you want from this life? What do you want your journey through, I guess, your time here to look like? Do you want to be a DNR? Do you want to be
A do not resuscitate.
Oh, sorry, a do not resuscitate. I mean, do you want you know, a tube in to help with nutrients as maybe we're not intaking as much? It's just having those really tough discussions, but I think I can speak with our family in particular. We're a very close family, and when we've talked about it, it's now in the past, and we all understand, you know, my folks' wishes and what they want for the kids. So I think it's just very important to have those discussions. Why not? You're doing yourself a disservice if you're not having the tough discussions.
You know, I thought it was a really good idea. A gal last week used her iPhone, and she laid it all out on her iPhone and uploaded it to the cloud and then emailed it to her family. And I thought, that's ingenious. So you don't have to sit anymore and type it out. But by her doing that, you got to see her facial, her expressions, her, you know, what she was dead serious about and her wishes. And so she just took her iPhone, and I thought, oh, there's so much technology. That's an ingenious idea.
It's a great idea.
And the family can play it for a doctor, or, you know what I mean? But just the fact that you got to see her expressing that and not just reading it on a piece of paper really was impactful. So, I mean, with all of the technology we have available today, we should utilize that for something like that.
You know, at Kindred, we have different programs that really start to kind of dig into people's wants and expectations for end of life in particular. And it's just interesting to hear the stories about families learning about things that they never knew about their loved one. You know, their wishes, or how maybe they wanted to be laid to rest, or maybe, you know, the music they wanted playing, or maybe they just wanted to be left alone. It's interesting once you start to kind of dig into a plan, for lack of a better term, what you find out and kind of what comes from those discussions. I really think it can bring people closer together.
Well, there's a variety of situations that you just don't think about that may happen, and it empowers you as a person to say, hey, if this situation happens, this is what I'd want to happen. And then also it relieves that burden from your family, everybody discussing, well, I think they would want this, and having to make those decisions.
Right.
Well, and I can't think of, so we were talking about earlier before the show about how men play this role in caregiving of usually taking care of the finances and the burden of making sure all the bills are paid. And so it would be, in my mind, it would be a man that could orchestrate, hey, we're going to take out our iPhones and we're going to do a family Zoom call, and we're all going to say what we want to happen, because there can be many different things that can happen, but it all comes down to an emergency. And when we get to the hospital, what do we want to happen?
Right.
And then what do we want to happen to our estate? You know, kids do the best they can in trying to figure that out if mom and dad haven't explained their wishes or you know, and let's just talk about the seniors. We have seniors aging, and it's unfortunate, but they don't know what their children want. And sometimes their children become the ones who are in crisis, but their children are also seniors at the same time their parents are seniors or aging. And so it's just so important to take those burdens off and just plan. Just don't be afraid to have the conversations, because it's so stressful when I see so many daughters and sons starting to fight. Well,
Right.
I need a caregiver to come into mom and dad's home because I'm burnt out. Well, that's going to cost $200 a day, and we get, you know, it takes all that off if, you know,
That's a good
if you
point.
plan it all out. So
You raise a good point, because, you know, going back to the lack of planning, you're right. A lot of situations where in critical times, and maybe you're losing a loved one, or your loved one is injured, one of the two, it can really get the emotions stirring amongst the family. And if they, you know, not only that, but you have back pre-COVID when you had doctors in and out, you had nurses in and out, you had specialists in and out of the room, and they're hitting you with agencies and insurance, and, you know, what would you like to do? Do you want to go home? Have you
Right.
looked at facility A or B? It's overwhelming. So if you don't plan and you don't, you know, it's interesting when you meet with a family and they say, nope, we already know what we want. We're going back with Home Instead, and we're going to get some home health with Kindred, and we're already set. I mean, the relief for families, and actually even the system, the healthcare system itself, it's the right thing to do. It's responsible, and it makes the transition that much smoother. So,
and we're all available. This is what we do. I think people think, oh, if I call, I'm going to have to pay to talk to someone, or it won't be covered. You can call Home Instead anytime. We'll help you do it, or we'll put you on the right path, show you the websites, the paperwork to fill out, or help you with your iPhone if you just want to tape it, or we have the GrandPad. There's so many things out there that don't cost anything.
Right.
To be more proactive than reactive. And I just think men, that's right up a man's alley, and the role of caregiving. Because how many times have we sat around the table and you've heard, you know, your dad go, oh, you can never put me in a nursing home. Okay,
Right.
well, if you fall and break your hip, usually a skilled facility is located in a nursing facility. So then you have a daughter going, oh, he can't go there for rehab. He never wanted to go to a nursing home. That's a nursing home. Well, he'd be okay, you know, once he understood. So it's so important to not take those types of conversations seriously and really get it concrete and laid out, you know.
And talk through it all.
Right, and we know, we're experts, we know the different types of scenarios when you may end up in a location that, you know, in a nursing home. Doesn't necessarily mean long term, you're going to be there forever, but why would you go? So we're more than happy to answer those questions and help, you know, take away some of the stigma of having the conversation, just so that families can plan.
well, and I think that is very important through, again, COVID time, just because, you know, unfortunately, if there is a rough situation, sometimes if you're coming out of the hospital into a skilled nursing for rehab, if things don't go as well as planned from a rehab standpoint, it could be one of the last times they see their loved one. And I think it's become more and more predominant throughout this year of utilizing home care groups, and allowing them that extra option to return home. Let's do therapy in home in the
Yep.
comfort of your living room. It's just, I think people don't know what they don't know. Just,
Right.
I don't know a thing about insurance, so it's the industry you're in. And just allow yourself to be vulnerable and allow people to guide you, because there are a lot of good people in our market that are very willing to just help and kind of steer you and point you in the right direction. Because heck, if I had not have entered the industry 8 years ago, I wouldn't know any of this lingo. I wouldn't know the difference between an assisted living and independent living.
in a nursing facility. And
Right.
And most people don't know those different terms. And so
Exactly.
that's why it's important to walk through
Right.
what you want to happen in different types of situations.
Well, we go to
100%.
lawyers to help us with things. go to healthcare expert. I mean, if we can just shift society's mindset to think that way, we're experts too. Just give us a call.
Well, Nick, you talked a little bit about what we're dealing with right now with the coronavirus, and the coronavirus does disproportionately affect the aging population. Most of the people who die from the coronavirus are the aging population, 8 out of 10. So what are some things that you're seeing in this industry right now centered around that, and how can families be engaged? And it goes back to that asking for help, what we've been talking about, how men typically don't want to ask for help.
Right. I would say the biggest thing I've realized as of recent, it's the burnout. I mean, obviously that's probably not the route we'll go with that, but it's a lot of what we're seeing right now in the industry is just exhausted. People are exhausted. Physicians, CNAs, RNs, they've been working nonstop around the clock through this whole thing. And as we get closer to the holidays and the ability to more than likely probably not get that time off that they were initially hoping for due to staffing or whatever it may be, there's just a lot of impacts there. But I think the biggest, it's more important now than ever to plan. It's nobody wants to get COVID, but I think as we've all realized, this virus has it doesn't care who you are, where you are. It's dangerous. So if or when this does happen, what are our plans? Where are we going? If I end up at the med center, what are my next steps? Maybe we've already been in discussion about trying some home care or some companionship care. Maybe it's that, hey, if I get COVID, let's get it in. Let's start to plan and get some support. I think people need to allow themselves to be supported. It's just so interesting, not only with benefits, so Medicare benefits, that's a lot of what I deal with. Theirs is a lot more private pay route, but it's interesting just people that have these benefits and we've worked for and paid into or whatever it may be, and we don't want to touch them. We just don't want to use them.
Well, and they can be provided in the home, especially
Right.
with COVID right now. So it's just a matter of picking up the phone. Your doctor's office will have a health coach. CHI has health coaches. The University of Nebraska, the med centers, clinics, the doctor clinics have social workers. They can answer all these types of questions. But so if your mom, for instance, or your dad has had a couple falls, you don't necessarily have to take them in. You can have a conversation with the doctor, and the doctor may say, okay, let's do a video call, and then he can order, or she can order home health to come out and do an evaluation. And then they can get the therapy right there in their home. They never have to leave their home. They can get their blood drawn. You can get your blood drawn in your home. So it's just a matter of picking up the phone, and you can start with the doctor's office and ask to talk to a health coach or a nurse manager or a case manager. You don't necessarily have to ask to talk to the doctor. And they'll start the process of guiding you so that your loved one doesn't have to leave their home. And that's usually a female role that does that, but there's nothing wrong with the man stepping up and making those calls as well.
Well, it only makes sense that if you need help with something, you ask the experts. Mm-hmm. In all situations, we ask the experts, and a lot of times afterwards, it's like, why didn't I do that sooner?
Right. I heard that knocking in my car, but I didn't take it in when I should have. Yeah, kind of thing. Yeah.
Well, with the coronavirus, there's some hope on the horizon with the vaccines that are coming out. But there's a variety of vaccines that are getting approved. And on the outside, it looks like these vaccines have been fast-tracked. But what can you say from an industry perspective?
I have heard all good things about the vaccines. I haven't heard, I watched the White House conference yesterday. I didn't hear anything that sent up my red flags from the healthcare industry. I thought it sounds very well planned out. It sounds like what they got rid of to fast track the process to me was a lot of administrative stuff and organizing how they were going to make the vaccine, manufacture the vaccine, and distribute the vaccine, which my understanding is that's usually what takes so long to get something out there. So I think always, an individual choice. Check with your physician. But yes, I'm excited to see that England has already started the process. And so I'll be excited for America to get it and us to actually, I'm going to take it, but I've already checked with my physician and that type of thing. So yeah, I think the best thing to do is check with your physician, and if they're okay with it, it's go get it.
Well, and checking the CDC website, they're making determinations on who would be best to get it. And it looks like they're thinking it may be healthcare personnel, essential workers, people at high risk, and those maybe over age 65 would be some of the first people to get it.
I do know of one independent community, assisted living community here in Omaha, that it sounds like they're slated for their residents to already get it. So that tells me that the CDC and at the state level, they're already talking to those communities that care for seniors so that they can be inoculated right away, which is great.
And so this will be something that's ongoing, so everyone won't have access to it right away, but still it's just a piece of the puzzle. It's just one part of it.
Right. I think a positive out of this whole pandemic is it did open up the conversations. It caused us as a nation to be in a crisis as a whole, and it affected a variety of ages. And so I think when we come out on the other side, if we can continue to have the conversations of, if I get COVID, this is what I want. Okay, well, now let's talk about all those other things, those other ifs. So I think that's a positive. I think it has taken down some of those barriers. People may have been resistant to let people in their homes. I think that, has kind of changed too, where people are more apt to want services to come to their home versus going out. So I think when we have more time to reflect, we'll really get a grasp on what the good things we learned. So I'll be curious, but yeah.
And then in the meantime, still doing the basic things that we've been told that actually work and that have worked in other countries too, like wearing a mask, physical distancing.
Smaller groups. Yeah, we're just not, as Americans, we're just not used to that.
Washing hands.
Yes, and we should all be washing our hands.
I mean, that's a normal thing. So in New Zealand, they said that based upon comparing last year to this year, their flu rates are down 60%, but they believe it's due to the COVID protocols.
Yes.
So really washing hands and wearing a mask, and you can reduce it 60%. Wow.
I've wondered about that. Yeah.
Yeah.
At first I was thinking maybe the numbers were going to be skewed because we were coding, we were basically diagnosing them as COVID opposed to having maybe influenza anywhere in there, but that makes a ton of sense that it would be a lot less. It'll be interesting to see what happens as we go into early stages of 2021 too.
Yeah, here as well.
I would just really encourage people to go to the CDC website and read it for themselves. And use common sense. If it walks like a duck and it quacks like a duck, it's probably a duck. So common sense, and just read it from the CDC. Don't listen to the guy on the corner who
heard what somebody said.
Right.
His cousin who works for.
Read a tweet.
or the tweet or the Facebook post. Everybody, I think, has the best intentions.
Yes.
But if we educate ourselves, I think that will be a really good thing too.
Educating ourselves firsthand.
Yes. Yep.
At the source.
Please don't drink any. Take vitamins because it's going to get rid of COVID. That's not the case. So read the CDC guidelines, that type of thing. Educate yourself. Talk to your doctor. What's best for you.
Again, talk to your doctor, seeking the advice of experts.
Yes.
Because there are people who know a little bit more than us about particular subjects.
Yep.
That's true.
Definitely.
We hear a lot about menopause for women, but now it seems like there's this new topic of male menopause. Is there such a thing as male menopause?
Is there, Nick?
I don't know, Chandra. Is there?
I think so. I mean, it happens to women. It's got to happen to men. I see these clinics popping up for men throughout Omaha and the surrounding area. So I think so. What was the old saying? midlife crisis, isn't it?
Yeah.
Isn't that the men's menopause? I'm sure if it happens to us, it happens to you. Sorry.
It'll be interesting. I think we might see a shift in men's health for probably the better with the Gen Zs or millennial group. I think that this group has been taught at a younger age to pay attention to our health and our bodies. I think the curriculum was a lot different. I think that the events that they made you partake in, just from like a wellness standpoint. I think that with the increase of larger companies doing wellness programs for their people, I just think it'll become more and more important as time progresses. It's still a little dicey though, I would say right now, but.
Well, and we do know that there are hormonal changes, that men do experience hormonal changes as they age. And then, for example, they might get hairs in weird places, like their ears or their nose, that random long weird hair that comes out of the
seeing
ear.
it in your grandpa, you're like, what is going on over there?
See, it's just hormonal.
Right.
Maybe a change in sleeping patterns, and that happens in female.
Melatonin, it happens in men too. So yeah, once again, doesn't hurt. Go to the doctor, get your physical. It's not unusual that you lose melatonin as you get older. Your eyesight at 40 starts to change. That is both female and male. But hearing loss is not normal. And it's interesting how this year, I don't know if it's because family members are at home, but I've heard many people complain that men do not like to get their hearing checked. It's a pride thing. They don't want to get the hearing aid, and I find that very interesting.
Well, I agree with everything you said. I would say, one thing about being proactive and whatnot, it's listening to your body. If you're not, just like through COVID, right? We were all told if you have symptoms or you're feeling under the weather, to stay home. It's the same concept at just a different scale. If something's off or it's not the normal you, then probably something's off. And it doesn't hurt to go get that checked. One thing though I want to kind of I don't want anybody to do a disservice for themselves. And as we get older, I think sometimes we have an energetic reaction to just blame our aging for different types of issues. But unfortunately, there are people don't dig into the programs that could help with those certain things. And I go back to turning to industry experts because some of the success stories are incredible. A home health plug for them, but they have a Safe Strides, a balance program basically to help folks that have been falling frequently, and the impacts and the things that they're trained and taught to do with their patients, not only with their eyes, but their inner motors, their ear canals, all of that. It has had somebody that they never thought their dad would walk again, and they're walking again and back to independent. And it's incredible. Those stories are everywhere. So I think if you listen to your body proactively and you realize something's off, you can get in front of it, but don't do yourself the disservice to just saying, my hearing's, exactly, this is it, because it doesn't need to be like that.
Well, and I've learned as I've professionally grown in healthcare that aging, people blame it on a lot of things, but a lot of things are not related to aging. They're just related to life circumstances.
And lifestyle, possibly?
Yeah, you listen to the music a little too loud for a little too long in your car for a little too many years.
Yep.
So now you're hearing. Or, you were a police officer and went to the firing range, or you were in the military and you fired a weapon, or those types of things. That has nothing to do with aging. That has to do with environment and circumstances. So, but yeah, don't blame it on aging, because we're finding that a lot of things are not typical just because you're older.
If you hear yourself saying, blaming it on aging, maybe just get it checked out.
Well, and the hearing thing, spouses, I've seen so many little spats because a spouse couldn't hear what the other spouse said, and they answered wrong, and then the other spouse is like, what? Or if I have to repeat myself one more time. So it's like, once again, it's not just about you, it's just how does your health issue going to affect your loved ones around you. And how would it benefit you to just get something taken care of so that you're living the most active, independent, productive life you can live? So,
Well, I want to talk a little bit about diabetes. Diabetes as it relates to men. I had spoke with someone recently and she said that it was okay for me to share this. She shared a story with me about her father and how he had lost his sight. His sight was black and white. But the way they found out is he was at a stoplight with his wife and he said, "What color is the light?" And she said, "What are you talking about?" He said, I don't know what color the light is. And so he had been losing his vision, but he hadn't said anything and he lost color. And it was related to having diabetes. He had other symptoms. He knew he had the symptoms. He did not share the symptoms. And that is how they found out when they're sitting at a light. And so that's not, and by that time he was pretty far down the road.
well, so thirsty. You're really, really hungry. You're frequently urinating. You're tired, headaches, those types of things. You don't heal as well from an injury when you have diabetes. Your feet become another really big issue. And it's not, I've seen men over 50, like 51, 52, all of a sudden one day they're fine and the next day they're like, I'm going to the bathroom like 3 or 4 times in the evening. And you're like, well, is that something normal? And they've gained 10 or 15 pounds. None of these things are normal. And they're just, well, I just figured I was getting a little older. Prostate is doing something. Well, no, your prostate's fine. You have diabetes. And that's why you're hungry all the time, but you're also exhausted. They thought, oh, I was eating, I've gained this weight, so I'm tired. Oh, I'm eating and drinking more, that's why I'm going to the bathroom. And I have headaches because I'm exhausted, and my vision isn't as good because I got older. No, it's because you have diabetes, or you're on the verge of having full-fledged diabetes. And the thing to remember about diabetes is once you have it, you have it. You're not going to it's never going to go away. It can become very manageable, but so once again, just if like Nick said, listen to your body. If you go from sleeping through the whole night and never using the restroom to all of a sudden it's 1 to 2 to 3 times on a regular basis, something is going on.
Now, Nick, you had mentioned falling before. And so there are these things that you can do to be proactive, like your diet and other things. So physical activity is one of those things that seems to benefit people in a lot of areas. But there's this kind of weird dynamic that happens that sometimes as people age, there's a fear of falling, so they limit physical activity, which affects physical activity and affects falling.
Yep, 100%. Yep, and it's kind of a snowball effect, and it's what the most common one. You can really spot them once you're in the industry for a while. You can almost spot them just walking down the street. It's all very common. It's the slouching. It's the hunching over. It's the shuffled gait. It's different things that you're right, that people get nervous. They don't maybe want to do as much bathing, or they don't want to, they have no desire to go to the kitchen to make meals, or they get too tired. They don't want to risk falling, going to pick up the phone and call their whatever it may be. It can have a ton of different impacts, but again, knowing that there are a ton of different programs in the city that can support your needs, and maybe you will never be able to walk the same again, but there are, again, different needs and resources that can be applied to get you what you want. So,
and I think it's like anything else. If you're not moving, then your muscles get weaker. So a body in motion is an active body, that type of thing. So if you don't use it, you lose it. That's very true. And if your vision has changed, which it does change after 40, that's a scientific fact. And depending on different healthcare conditions, you can lose some peripheral vision. And that really, think about it. I can look and see pretty far, but if I couldn't, that's going to change how I walk.
Mm-hmm. Right.
That's how, we find people break their wrists when they fall because they're trying to break their fall because they didn't see the handrail, they didn't use it. So once again, it goes back to listen to your body, and if you're changing, contact an expert and use the resources that are available to you so that you don't have those problems. There's so many things you can do now at home to avoid falls, to help with vision, hearing, but we don't think about how all those things play into our daily life until one of them isn't working right. So
It's true. Well, even and take it a step further and take med management. We often see that
Oh, yeah.
People are non-compliant with their medications. You'll go to their house and they'll pull out a box and they'll have all their pills in it, and they go off the color, the shape, the size. That is how they are going about their medication regimen, if you will. And think about the impacts if you aren't taking them routinely, or if you're mixing them with something. All kinds of things can happen, from falls to impacting your diabetes. It really, that's one of the biggest things that cause issues and hospitalizations is simply med management. So again, recognizing and understanding as a person, like, hey, I need some help with this, because as we get older, there's a lot of pills for everything, vitamins and.
yeah. Well, and most people don't know most pharmacies and a pharmacist will reconcile your medication at no cost. So if you go to the same pharmacy, even if it's a mail pharmacy that mails you your medications, you can talk to a pharmacist and say, what are all these different medicines I'm taking? Are any of them for the same? Am I taking 2 drugs that I could be taking 1 for the same condition that I'm taking 2 for? So I didn't remember that one, but medication, that's usually one of the first things I always ask a family. Has your loved one changed their medication? Are they on a new medication? Have they stopped a medication? Is it any medications time released? Does it take time to build up in their body and now they're not taking it? So yeah, medication reconciliation. I always tell families, do that before you do one of the first things you do.
Yep.
And it's free. The pharmacists, they just do it for free.
I did not know that. I had never heard that before. That's just something really fantastic to know.
Yeah, and vitamins affect that. So if you have a sleeping pill or an antidepressant and you're taking melatonin, and you can't wake up your grandma, maybe we can back off that melatonin just a little bit. But I'm not a pharmacist, but yeah, definitely.
Well, because a lot of times you think if you're taking something over the counter, you don't think about how it's interacting with anything else. You just think, it's over the counter, it's fine.
Right. It's not going to affect, my iron pill and do I have too much sodium? I've seen a couple of people where they hospitalized because they have too much sodium in their blood. Well, they were taking some supplements and their eating habits caused that. So
Wow.
Medication reconciliation, yeah.
Well, since you're both here, I want to talk about something that is often misunderstood and has a little bit of stigma to it, and it's hospice. Can you please explain hospice? What is it? When would someone utilize it? And is it scary? Because it sounds scary.
I can take that one. Yep. So I work solely in the hospice space. So I work with patients and families and different people all about the city. And really, you hit it spot on. It's the word hospice. And if I could call it home health, I would. I think it would be, or extended care. But
Now that doesn't sound so scary.
Right? I know.
Home health, extended care, I could go for that.
I agree.
But hospice sounds scary.
Hospice sounds scary, but I think the biggest thing about it is, and it goes back to this whole discussion, is if you put a plan in place and you're proactive about what you want out of your journey, out of your healthcare journey, and what you want for your loved ones, then you're going to be set. You are going to have a great hospice experience, because really all we are doing is taking care of the I say nitty-gritty, behind-the-scenes clinical stuff, to allow the families and the patients to spend more time with their loved ones. So there's a whole crew that's provided to you if you came onto hospice, from nurses to hospice aides to psychosocial, so social work, spiritual, just a whole group of people that their whole purpose is to figure out how do we increase your quality of life, and how do we increase your dignity. So I think everything's circumstantial, but if you are scared of hospice just because of the word hospice, you are doing yourself a disservice, because it really impacts and changes people's lives every single day. So
I have found, I've had many aging adults that I've worked with that have been on hospice, and they do not pass away. They come off a hospice and they live longer because of the hospice experience and the regiment and the things that a hospice team does. They end up coming off a hospice and living a couple years later. I mean, Homestead was founded on Paul Hogan's grandma, who they told Paul's mom, "You're gonna have to take your grandma home, your mom home. We expect her to, she'll pass, so we're gonna send her home with hospice." She was on hospice, I think, for some weeks. She came off a hospice because, the family started to come in. They had a good plan. She lived for 12 years.
wow.
After that. So hospice doesn't necessarily mean you're going to die tomorrow.
Right. And I think it's become more important now than ever with COVID, because our biggest objective is to mitigate any gaps in care. So if we're ever thinking, our loved one is unsafe at home because of a fall risk, or because they're getting multiple UTIs, or maybe they're on 2 liters of oxygen, whatever it may be, it's just knowing that we can support those needs, and they don't have to do it alone. And I just don't think enough people utilize their benefit. In fact, I think our national study said it's like 66 or 76% of people that came onto hospice said that they wish they would have came onto hospice sooner. Additionally, folks that utilize hospice tend to live 29 days longer than those who didn't utilize hospice care. So it's just interesting, the correlation there, because it really does not mean giving up. It just means you're taking a different journey on a different level of care, and we just want to take the journey with you. So.
Well, and the daughter, it's so important. The daughter stays the daughter, the wife stays the wife, the son stays the son. You're not the nurse aide, you're not the bath aide. And
good point. Yeah.
I've never met a parent wants their child to give them a bath.
Right.
I've never met. So these are just, once again, you've paid for these benefits. At the minimum, make a phone call, learn about what the benefit entitles you to, because you've paid into it for so many years, and then make a decision. At least it will have been an educated decision on what you decide your journey is going to look like.
And you're right, there are a ton of different financial benefits, whether it's maybe you're paying for a bunch of supplies for your loved one, or maybe medications that are costing a buku bucks each month, and just the care itself. All of that is covered through your Medicare benefit. So why not use the service that you've paid into your entire life? It's all it is. It's a service back to you, and it's not binding. If it's not working for you, then you can try a different agency, or you can come off service and try home health, or whatever works best. But I would challenge people to not be timid or reserved by the word hospice, because it's just a service.
It sounds like a big part of this, there's a couple of themes that keep going through, but it's just really educating yourself, because I have had friends say, well, now this is just a natural part of it. This is a natural part of aging, or now I have to give my parent a bath because it's a natural, this is just where we are right now. And like you said, nobody wants to do that. The parent doesn't want it, the child doesn't want it, but just knowing about benefits instead of making an assumption about what we know or don't know.
Right.
Exactly.
And if you choose to do that route, at least it will have been from a well-informed, educated, you're coming from a place of education and information when you decide the path that you're going to take. And I firmly believe it's never too early to make some of those decisions. Nobody likes to have some of those conversations, but do you want hospice? Anybody can make that decision at the age of 35, 40. Would you have home health? Do you want to live after 55, 65? Do you want to stay at home? What's that look like? Are we saving to stay at home, or are we saving because mom doesn't want to cook anymore and dad doesn't want to mow the lawn? So if we're making these decisions in our late 30s, early 40s to save for those things, it's not going to be a foreign concept to decide and make decisions for what's home health look like, what's hospice look like. How do I research these companies today and find out what are the best companies? So if something does happen, I know who to call. And if nothing happens for 5 years, at least I'll know how to research these companies when my parents or I get older. Once again, we have seniors taking care of seniors.
Yeah.
So it's just, we have to think, and we don't think of ourselves. I don't think of myself as an aging adult. Oh, no.
Aging adult. I
Yes.
don't have any idea what you're referring to, Jan.
Exactly. But it's true. It's true. So,
Well, we've talked a little bit about preventative and being proactive. So one of the ways you can be preventative is just to simply get screened. Get some early screening for potential health problems. Are there some early screenings that you can recommend?
the prostate, the diabetes, what else?
Well, even maybe like blood pressure and cholesterol,
Yes,
things
yes,
that you
heart
should
disease,
normally get
heart
checked.
disease.
Yeah.
You should go get your yearly physical. I
Right.
mean, most insurance, I'm not an expert, but my understanding is preventative care is usually covered now under most healthcare insurances. So go get your physical. I mean, once again, you're paying for your insurance and it's a benefit.
Use it.
Use it. What's it going to hurt? It's, go get your yearly physical.
Exactly.
And then I think another thing that's on my list to get screened for is any behavioral issues. So behavioral issues could be things related to anxiety or depression, changes that have happened, and actually talking with a healthcare expert about that.
Yeah, I would say mental health is still a hurdle as a country as a whole that we need to overcome. As I have been aging, I've noticed that my outlook and perspective on certain life events, I handled better in my 20s. I could let it, slide off. But as I've gotten older, it's not so easy. So I think, once again, there's usually a mental health benefit, and you can just do it a lot of times right over your phone and just talk to somebody. And once again, listening to your body, listening to, thinking about, well, gosh, I'm still thinking about this 3 hours later. I mean, before I wouldn't think anything of it. So, yeah, I think mental health. And as we get older, dementia's not normal. There's always a reason why people become forgetful. And so I think if you see a loved one having those issues, talk to them sooner than later. Had a girlfriend, I don't think she'd mind me sharing this. She literally left her keys in our work refrigerator like a month ago, and we were all laughing. And she's like, oh, I can't believe I did that. Well, she's under a lot of stress. She's got a busy work life and, daughter getting married, another son, trying to graduate with all this stuff going on. And she literally left the keys in the fridge, and we were laughing, but there was a reason she did it. So,
It's an indication of something.
yes.
So instead of brushing it off, this isn't normal behavior.
Right.
And so it's an indication of something.
Right. And usually, bills aren't getting paid anymore. If it's, your grandma or mom or dad, that's an indication. It's becoming too overwhelming for them because they don't remember, what, did I pay that bill? Did I not pay that bill? Maybe the mail, indication is the mail's not being opened. You go over to the home and there's mail on the table. The fridge doesn't quite have as much food in it as it normally does. So, and that's a good thing where a man can have those conversations with their parents way better and matter-of-factly than you find with the female daughter usually. So,
Well, Shan, you mentioned mental health. We had a mental health expert on recently, and one of the things that she shared is during this time of COVID that 1 in 4 people have experienced some type of episode, whether it's prolonged sadness or depression or anxiety or something along those lines, but many people don't seek treatment. As a matter of fact, 66% of people don't seek treatment, which goes back to what you were saying about there still being a stigma in our country.
Oh, I think so. I know. I'm sure Nick sees it especially in his field with the hospice, and just I'll get over it. It's not me. This will pass. I can handle it. Yeah. I mean, and then it's time. It's time off of work. Time, and then you have to open yourself up and actually share your fears, and that you actually have anxiety about something with probably someone that's going to be a relatively new provider that you've never seen before. Usually you have relationships with your doctors for years, but then all of a sudden you're sitting in front of this stranger, and it's hard to be open about, being in my house for 3 months, never going outside, or I want to go outside, but I can't go outside. Do I have a phobia? What's going on? Mm-hmm. That you're opening yourself up. So I think we as a society can do a better job. But once again, there's a benefit, and nobody has to know you made the phone call. It's just you and your doctor.
So if something is a little unusual and something's different, starting with that primary care physician, what if you're adult child of your parent, encouraging them to see the primary physician as a good place to start?
Yeah, or just, hey, Mom, let's get your, hey, have you got your yearly dental appointment done? Have you got your eyes done? A lot of times
Dental.
families, but families go to the same providers. So it's a perfect excuse for a loved one to say, hey, in 3 weeks, I'm taking the day off. You want me to see if I can get you in at the same time? And then we can go to lunch. So you're getting yourself involved, but you're not taking their independence away and making the decision for them. But you're encouraging them to get something done. So if you see some odd behavior, do something like that. Hey, I'm going to go see Dr. So-and-so. You want me to make an appointment for you? We can go at the same time. And then, can I join you, Mom? I'll just go in with you. Mm-hmm. Easy way.
Good tips. Well, Shannon Wilkins from Home Instead, Nicholas Harpster from Kindred at Home, you guys have been such a wealth of information. Is there anything you'd like someone to know in regards to men's health?
Just don't be afraid to call your provider. Start with your doctor. Don't ignore any symptoms. If it's unusual, it's unusual. It's not normal. It's not a part of aging. Don't ever use that as an excuse.
Take care of yourself through the holidays. I would say, as we round out the end of the year, we're probably some people are gonna be in a rougher place, or some people might be alone for the holidays. So just take care of yourself, take care of others, and listen to your body and be good to people.
Well, one of the biggest takeaways for me is it's not just because of aging. Like, yourself. So if it's different for you, get it checked out.
Mm-hmm.
Yep.
100%.
Exactly.
Thank you so much for joining us. Our Home Instead Aging Well series will continue after the new year. We have some really exciting things coming up. We'll be talking about financial planning at every stage, aging adults in the labor force. The over 55 labor force is actually the biggest growing labor force. Wow. We're going to be talking about that, smart technology and aging, conscious aging, and also estate planning. All of those things will be happening after the new year, and we look forward to joining you again. Thank you. Have a fantastic day.